Greetings, and thank you once again for joining us for another video update for our community. Today, I'm very pleased to be joined by Dr. Clarence Parks. Dr. Parks is our Chief Hospitalist. He's the Medical Director for the program. Dr. Parks is trained in internal medicine as well as pediatrics and is also a professor that teaches medicine. So we're really fortunate to have Dr. Parks spending some time with us today to try and answer some questions that may be on your mind. So Dr. Parks, thank you for joining us.
So there are various reasons for the resurgence that we're seeing in the country. We look at a couple of instances where it's important for us to note that all of the things that we've done, it's important for us to continue them. So in essence, we need to remain diligent in several things. And the aspects that are very, very important it's tried and true. We have to remain diligent in avoiding large crowds. We have to remain diligent in hand washing, good hand washing technique. I often say early and often, and when you begin to think about it, that's when you should wash your hands once again. And there is significant data out there that shows there are benefits to wearing a mask. So not only in public areas, but when you're thinking about it, you should be leaving your home with a mask on, going from car to grocery store or out in public with a mask on as well. And then keeping in mind, we should also remain diligent on the aspect of social distancing. So there is some science behind it, and it's well accepted, of the 6 feet rule when we're out in public. Wearing a mask is one of the critical aspects that we as a community can continue to do, not only for ourselves, but for others in the community. Wearing a mask is one of the things that will help reduce the droplet and the percentage of droplets that is aerosolized throughout the community. So it protects me from others when others wear a mask, and I protect others from myself when I wear a mask. So the studies tend to show that not only does it reduce large droplets, but it also reduces the propelling of the droplets throughout the air. And oftentimes that tends to slow that from transmitting to someone else who may be 6 feet away from us. So there are several aspects when we think about stopping the virus. This tends to reduce the virus population or reduce the virus that's in the air or aerosolize. And one of the other things that I often say to most individuals, which is critical, virus particles or aerosolization of virus particles tend to implant or invade the body through the nasal passageways. By wearing a mask, you reduce that vector or that source, or you also reduce the population of the virus that could get into the nasal passageway. So there are several aspects from the inflammatory or the infectious part of the process. So there are two parts. One part is the infectious part, where the virus actually first begins to invade the nasal passageway, and then by a process of biochemical reactions and also what we call in healthcare microaspiration, the virus particles then replicate and then attack actual lung tissue. So it gets into the lungs. Once it's in the lungs, there is an infectious process that we call the replication process, and then it tends to incite a cascading of events where there is an intense inflammatory response, not only from inflammation of the airway, but there's an influx of inflammatory markers like fluid and degradation of other sources. The white blood cells tend to attack the lungs, and that makes the lungs a little less elastic and more stiff, and it makes it more difficult for individuals to breathe. This is part of our inflammatory process. So we are ever finding out more information about the level of infectivity in terms of other organs that may be involved. One of the most important things that we've noticed is that the inflammatory process that tends to be incited with the coronavirus tends to be pretty hyper-responsive. So we see inflammatory reactions in not only the lung tissue causing what we call adult respiratory distress syndrome, but we also see that in the kidneys and the liver, as well as heart tissue and blood vessels tissue. So as our data evolved, we learned more about this process, and stroke is usually one of those things that we tend to see. Renal failure or kidney failure is one of those things that we tend to see when the inflammatory responses tend to be a little bit higher than what we would want. The virus has definitely mutated. We've learned that the virus that we knew about in the New York population was definitely different than the virus that we were seeing in the Chicago area. There was a special mutation that had taken place. So we also know that there is ever-present changes in the factors for the mutation. For instance, we do know that the surface proteins on the virus, so if all of you can recall some of the images that we see about the virus, there are spike proteins that are on the surface of the virus that tends to impact how well or how severe the virus gets into the human body. So we know that the mutation on a particular protein called the S protein, which is just the surface protein of the virus, that protein mutation has made the virus more infectious. It has not necessarily made the virus more fatal or more severe in terms of its illness, but it's made it more infectious. So that's one of the things that we have noticed. We've noticed that this is something that we would call antigenic drift and not necessarily a shift. So there's not a shift in the biochemistry of the virus, but there's a little bit of a drift or a mutation from it. So our advisory team has regular meetings. We've been meeting almost on a weekly basis for the sharing of information. We're quite proud of utilizing our professional sources as well. The information, as we've mentioned in our last meeting, was something that has been coming through at lightning speed. We're quite excited about the sharing of the collegial information so that we make real-time changes that has an impact on our community. So we've been staying abreast by reading every article, every piece of information, every scholarly activity that may come out on a listserv, and then we bring it to our group and we employ that in our changing of practice here at FHN and overall for our community. The most important thing that I want to remind every individual about is that this is a pretty significant viral pathogen that's out there. It is also something that we have not seen before in healthcare. And in such, it is important for us to remain diligent. As I mentioned before, we need to remind ourselves of the things that have been successful. There are several things that we can do as an organization and as a community to keep ourselves relatively safe. Once again, the first thing that I want to remind people of is it's really important for us to maintain social distancing. It's important for us to mitigate risk by avoiding large crowds. It's important for us to protect ourselves and others by wearing a mask when we're out in public. And one of the most important things that tends to be often forgotten is it's important for us to avoid touching our faces, but washing our hands early and often.
In Northwest Illinois, we've been fairly fortunate that there has been a slowing of the spread of COVID-19. While we are seeing an increased number of cases being positive, those cases are proportionate to the amount of testing that we're doing. And speaking of testing, I'd like to mention that FHN and Stephenson County Health Department have partnered to be able to offer a couple of mobile testings this month. So on July 14th, we will be offering a community-wide testing at Ackwen. And then on July 28th, we'll also be able to offer some testing at Taylor Park School. So please check our website for more information about that upcoming testing. But once again, as we start to do a lot more testing, we're going to see that type of activity occurring. Fortunately, at FHN, we still remain without any positive COVID-19 patients in-house, and that's been consistent since my last video update with you. So we're glad to be able to report that out, and we hope to be able to hold fast to that. However, that's pretty much unlikely. We know that we're going to see some increased activity, and it stresses our need to continue to exercise caution. We've seen that happen after the Memorial Day weekend. We had a slight uptick as people were getting together and were socializing and maybe not following as many of the precautions as diligently as they should. And then certainly this past July 4th Independence Day celebration, we've seen a lot of groups getting together celebrating, which is a good thing. However, when you have that increased contact, it's more than likely that we're going to see a potential increase or rise of COVID-19 positive patients. I think it's a little premature to term the rise that we're seeing in other areas of the country as a second wave. It's more likely a surge from the initial infections and the continuation of that versus an actual second wave. So I would term it more of a surge. Usually a second wave, when we think about that, is there's been a break in activity. We've had a lull or a decrease or very low volumes, and given some time, then all of a sudden this next wave or that second wave comes back, oftentimes even more significant or severe than the first initial exposure. And I think there's some good history on that if we go back to the pandemic of 1918 and other type of infectious disease outbreaks that have recurred or we've seen a resurgence of as that second wave. The concern for a second wave is more likely going to be experienced in fall. We don't know for certain, but with the increases of the flu and then also other respiratory diseases, it's very likely that it could occur at that point. So I think what we're seeing right now is just a surge from the initial infection rate of COVID-19. It can absolutely make a difference of what kind of mask people are wearing. And Dr. Allender was able to share some information with us on wearing masks, and you can see that at our website on one of our community videos. I believe it was June 8th that he did that. And what Dr. Allender was talking about were specific uses of masks for different people. So for example, Dr. Parks, who wears an N95 mask, that mask is designed not only to protect patients, but also to protect him. So it has that two-way protection, and it's very fine, and it screens out a lot of particles so that that transference of viruses or bacteria is very limited or very minimal. Whereas a cloth mask that many of us wear out in the community or in public, that's really not designed to protect the person wearing the mask, but more so for others surrounding them. So it prevents that droplet or that airborne spread being pushed out into others. So it creates that physical barrier where that isn't as prevalent, and so it's protecting community members versus the actual wearer. Different masks are designed for different purposes. We have a procedure mask, which is what I wear most often walking through the hospital, that is not as barrier resistant as an N95, but I'm not providing direct patient care, or I'm not working directly with patients for extended periods of time. So it's perfectly acceptable for me to be wearing that because it provides protection, not only for me, but it also provides protection for others, which is what we're really concerned about as healthcare workers, is protecting everybody through that. You'll see different advertisements for different types of masks. I would just issue a caveat emptor, or buyer beware. Is a lot of times information that's being shared, you may want to make sure that it's been clinically validated, because there's a lot of claims being made out there. The biggest takeaway, though, for community members is wearing a protective barrier, covering our face does make a difference, covering the nose, covering the mouth, to help limit the spread of COVID-19. Just like any piece of equipment or any tool, it does make a difference. If it's not used properly, it's not going to be able to provide the protection to others or protection for the wearer if it's designed to do so. So for example, I've been out in the community and I've seen people with the masks where it's been pulled below their nose, or it's actually been pulled below their chin. That is not providing an effective barrier for anybody, and it's really important that we're covering both the nose and the mouth in order to use that effectively. If it's not, there's a concern about what type of function it's even really providing. So it does make a difference on how well the wearer is actually, not only how well they're wearing it, but how consistently that they are as well. That's a tricky question to answer because it depends on what kind of mask it is, what kind of facial covering it is. Here at FHN, we have very regimented protocols as to how long somebody can wear a procedure mask, how long somebody can utilize an N95 mask before it has to get sterilized, how long they can even just sterilize them, how many times can that happen. So we have it very well organized, and we have a very set process on how to do that. Out in the community and for the general public, that's probably not as applicable nor as important. But a few things to be concerned about, even wearing the disposable masks, again, they're disposable, so we have to be cognizant of that. If the fabric is ripped or it's no longer able to provide a complete covering, it may be time to replace it. If it's stained, or if it has visible staining on it, then that's certainly a time that it needs to be replaced. If we're wearing cloth face coverings or masks, it's important that those need to be washed. So they can still harbor bacteria if they're not washed on a regular basis. For myself, is when I'm wearing a cloth face covering or a mask, I like to wash it every day, or at the very least every other day. So usually when I get home and I know that I'm not going out, I just use some good soap, just like when I'm doing my proper hand hygiene, wash it, set it out to dry so it's ready to go for the next day. I also find it's a little bit more pleasant when I'm breathing in a mask all day We do get odors that are generated, and the mask will start to store those. So regular cleaning is really important, and certainly making sure that it's in a condition where it's able to do its job. Where we see the strings or the straps that are getting frayed, that's another indicator. You don't necessarily want that to be breaking in public and you don't have another mask with you. So just taking a look at it before the start of the day is important as well. I don't know, but I'm certainly looking forward to it. And I think if you're being given a date of that we can stop wearing masks on such and such a date, I'd be highly skeptical because it depends. We really need to see what's happening with the activities in our surrounding areas. We also have to see what type of effective treatments have been developed. Currently, we don't have a highly effective treatment for COVID-19, and that's a major concern, as well as a lot of discussion about vaccines. It's going to be still some time before we have a clinically proven safe vaccine that we can utilize and then get that widespread and implemented throughout our community that would make it safe for us not to be wearing face coverings or to be wearing masks. So again, as I started, I don't know. I'm looking forward to that time when we don't have to wear it. However, the science isn't quite there yet, and we really do need to listen to the experts, and we know that that guidance is changing on a regular basis, but that's to be expected. As we learn more, the information becomes more abundant and hopefully more useful for us. The current positivity rate will vary through different areas of the country and certainly through different areas of the world. There have been some claims that people have been making, very public figures making statements about the vast majority of people that have COVID-19 don't have any problems or it's not serious. While that's accurate, the vast majority of people that do test positive for COVID-19 may be healthy. They might have no symptoms. They may have minor symptoms. But what's really important is the people that are being impacted. And that percentage, no matter how high or how low it is, can be very serious, where people are being hospitalized. And unfortunately, we've even seen a number of fatalities. And we talk about maybe the death rate declining, which is a good thing. However, that doesn't mean that the illness rate has gone away, and we have to be sensitive to that. When we look at the testing being done in Illinois, the latest numbers that I've seen from the Illinois Department of Public Health gave us a positivity rate of about 2.5%, which is well below the national average. However, again, depending on who you are and how significant COVID-19 is impacting you, the positivity rate isn't something that I focus on because it's serious when people are experiencing difficulty. And some of the things that I like to watch are what are the hospitalizations that we're seeing where people are acutely ill. So when we're talking about positivity rates, again, that's going to vary depending on which day, which area, who's necessarily reporting it out, and what's really within that data. We still have to take this very seriously and not be dismissive, even though the vast majority of people that test positive will be fine long term. As I mentioned, some of the websites that I like to rely on are the Illinois Department of Public Health. And then I also like to go out and to check the CDC, or the Centers of Disease Control and Prevention. And I do look at other websites, though I'm always going back and kind of fact checking what I read on one site to compare it to some other source data to make sure that that's lining up. The National Institutes of Health is a very credible organization, but sometimes their information is very recent and cutting edge. And so they're sharing a lot of observational experience that later, as we learn more, you come back, it may be a little bit different. The same thing with Hopkins Medicine. John Hopkins does some great work, and they've been very well known about some of the data that they're reporting out. But again, that shifted, there's always more detail behind it. So even when looking at different types of sources, I do try and validate that by confirming it with other data or other sites or sources. One of the places that I'm a little bit skeptical on is the media sources as it's being reported out in the news. Oftentimes you may have had this experience, you're watching one channel that reports one thing, you turn it to another channel and they're reporting something else. And so it's really trying to figure out where is that report coming from and getting to the source data and thinking like a scientist. You want to validate what it is that's being shared, just not taking it at face value from what somebody has said, or because it was in the paper doesn't necessarily make it so. Again, real-time data being published by the Illinois Department of Public Health and the Center of Disease Control are some of the sites that I tend to be more trusting of. And of course, our website, www.fhn.org, we try and provide links to sites that we feel are providing the most accurate information. Over the next couple of weeks, I would say enjoy. It's a great time to be out and about. And we spent a lot of time in this video talking about masks, and I know that that can be frustrating, especially in high heat and high humidity. But it's important to stay hydrated, make sure that you're drinking plenty of water, you have good fluid intake, and like many people, that heat will sneak up on us. For myself included, doing work outside, working in the yard, is to make sure you're taking frequent breaks. And by the time you start to feel thirsty, or by the time you might start to feel a little bit lightheaded, it's already kind of too late. So you need to pay attention to your body, listen to it, and respond appropriately. Some of the other things that happen during heat-related times is surfaces can get slippery. We don't necessarily think about that in summertime, but with air conditioning, with high humidity, with slick floors or tile, that also can start to build up some moisture, which could cause slips, trips, and other hazards. Another environmental concern that we don't talk about often publicly, but in this really high heat that we've had in Northwest Illinois, our roads are starting to buckle. So you might see some of that asphalt folding over itself or collapsing. So there may be another bump that you weren't expecting, or a hole. And it's not just about damage to your vehicle or potentially causing an accident. It's also, if you're out biking, out running, it could become another fall hazard as well. Making sure that we're wearing sunscreen so that we can enjoy the sun without necessarily having the after effects for days thereafter is also something important. But with the appropriate use of a good amount of safety guidelines, there is so much that we can do and enjoy. It's a beautiful time of year and a great time for families to get together, to be out, and to really shop locally, make sure that we're supporting our local area businesses, and being grateful for all that we have and that we're able to do.